Lesson 5, Sudden Illness. Any serious illness or injury can lead to shock, a life-threatening condition. Signs and symptoms of shock include restlessness or irritability, changes in level of consciousness, pale, ashen, or grayish, cool, moist skin, rapid breathing and heartbeat, excessive thirst, nausea, and vomiting. Call 911 or the designated emergency number immediately, and then have the person lie down if possible. Control bleeding if that's necessary. Cover the person with a blanket to prevent loss of body heat. Do not give the person anything to eat or drink if the person complains of thirst. Reassure the person until EMS personnel arrive. Heart attacks. We've talked about heart attacks in previous lessons, so we're going to go through this pretty quick. We're not going to watch that video. There's some signs and symptoms of heart attacks, as we've seen in previous lessons. Breathing emergencies, signs and symptoms. No breathing, shortness of breath or trouble breathing. Being unable to talk without stopping for a breath in between every few words. Changes in breathing rate, fast, slow. Depth could be shallow or deep, or the rhythm could be irregular. Signs and symptoms, gasping, wheezing, gurgling, or high-pitched noises. Changes in skin color, dizziness or lightheadedness, chest pain, and apprehension or anxiety. If a person's having trouble breathing, determine whether to some EMS personnel. Remember, do not be afraid to call 911. If you are going to err on the side of caution. Help the person to rest in a comfortable position. Sitting and leaning forward slightly often helps make breathing easier. If the person is finding it difficult to talk, phrase questions so they can be answered by nodding or shaking their head. If the person's having trouble breathing, offer to help the person with his or her medication if they have some. Continue to watch for changes in the person's condition, and be prepared to give CPR and use an AED if the person becomes unresponsive.
People with asthma may have difficulty breathing when they are exposed to certain substances or conditions called triggers. Common triggers include exercise, temperature extremes, air pollution, strong odors, allergies, respiratory infections, and stress. Exposure to the trigger causes the airways to swell and become narrower, making it harder for air to move in and out of the lungs. Signs and symptoms of an asthma attack are similar to those of any other breathing emergency and include wheezing or coughing, rapid shallow breathing or trouble breathing, being unable to talk without stopping for a breath in between every few words, anxiety and fear, sweating. A person with asthma can minimize the frequency of asthma attacks by avoiding triggers and taking prescribed long-term control medications. But when an attack occurs, prompt action is needed to open the airways and restore normal breathing. The person will most likely have a prescribed quick relief or rescue medication to use in the event of an asthma attack. Encourage the person to use his or her quick relief medication as directed by his or her healthcare provider, assisting if needed and state or local regulations allow. Call 911 or the designated emergency number if the person's breathing does not improve within 5 to 15 minutes after taking the medication, or if the person becomes unresponsive. Monitor the person's condition until the person is able to breathe normally or until help arrives.
A person with asthma may take quick relief medication to stop an asthma attack. These medications work quickly to relieve swelling, opening the airways right away, are often administered through an inhaler. Shake the inhaler, remove the mouthpiece cover, and attach the spacer if used. Give the inhaler to the person and advise the person to use it as directed by his or her healthcare provider. If the person's breathing does not improve within 5 to 15 minutes, call 911. If the person becomes unresponsive, make sure 911 has been called, and then begin CPR immediately and use an AED if one is available. Anaphylaxis.
Anaphylaxis is a severe allergic reaction that can develop within seconds or minutes of being exposed to an allergy trigger or allergen. A person who is experiencing anaphylaxis may have trouble breathing and go into shock. Because anaphylaxis is life-threatening, it is critical to act quickly to stop or slow its effects. To recognize anaphylaxis, look at the situation and the person's signs and symptoms. If you know that the person has been exposed to an allergen, look for trouble breathing or signs and symptoms of shock. Remember that signs and symptoms of shock may include excessive thirst, pale, cool, moist skin, changes in level of consciousness, and a rapid, weak heartbeat. Unknown exposure plus trouble breathing or signs and symptoms of shock equals anaphylaxis. If you think the person may have been exposed to an allergen, look for any two of the following signs and symptoms. Any skin reaction, such as hives, itchiness, or swelling. Swelling of the face, neck, tongue, or lips. Trouble breathing. Signs and symptoms of shock. Nausea, vomiting, cramping, or diarrhea. Any two of these signs and symptoms, in combination with suspected exposure to an allergen, equals anaphylaxis. If you do not know whether the person has been exposed to an allergen, look for any skin reaction or swelling of the face, neck, tongue, or lips. If the person has a skin reaction or swelling, and the person is having trouble breathing or showing signs and symptoms of shock, then assume anaphylaxis. When you recognize that a person is experiencing anaphylaxis, have someone call 911 or the designated emergency number immediately. If the person has a prescribed epinephrine autoinjector or an autoinjector is available and you are authorized to use it, help the person use the autoinjector. When administering an epinephrine autoinjector, be sure to hold the leg firmly during the injection to limit movement of the person's leg. Remember that anaphylaxis is a care-first situation, so if you are alone, help the person first and then call 911 or the designated emergency number. While you wait for help to arrive, make sure the person is sitting in a comfortable position, or have the person lie down if he or she is showing signs of shock. Provide reassurance. If the person is still having signs and symptoms 5 to 10 minutes after the first dose, and emergency responders have not arrived, help the person administer a second dose if another autoinjector is available.
There you see a couple examples of what the EpiPens look like. Person showing signs and symptoms of anaphylaxis, call 911, help the person use the medication for the emergency treatment of anaphylaxis. Make sure the person is sitting in a comfortable position, or have the person lie down if he or she is showing signs of shock. If you're alone, help the person with the medication and then call 911. Signs and symptoms: dizziness or shakiness, headaches, cool moist skin, changes in behavior, confusion or disorientation, loss of consciousness, seizures, or both. If the person is responsive, diabetic emergencies. If the person is responsive and able to safely swallow, give them 15 to 20 grams of sugar. I would advise writing that in your notes. Check the label on a packaged product to determine how much the packaged sugar is in the package. For diabetic emergencies, call 911. If the person becomes unresponsive, they cannot swallow, the person does not feel better within 10 to 15 minutes after having sugar, you cannot immediately find any type of sugar, which in our society, that should not be a problem. To care for the person having a seizure, let the seizure run its course. Remove nearby furniture or other objects that could cause injury if the person hits them during the seizure. To care for a person having a seizure, when the seizure is over, check the person for responsiveness. If the person is responsive, check the person from head to toe and place the person in the recovery position. Stay with the person until he or she is fully recovered and aware of his or her surroundings. Call 911 if the seizure lasts more than 5 minutes or the person has had multiple seizures, the person was injured as a result of the seizure, the person is unresponsive after the seizure, the person is pregnant or has diabetes. Also call if the person is a young child or infant and the seizure is brought on by a high fever, the person is old, elderly, person's first seizure or the cause of the seizure is unknown, or if the seizure took place in water. Fainting. Person who is about to faint may become pale, begin to sweat, complain of dizziness or weakness. You may be able to prevent the person from fainting by having the person sit down and put his or her head between her legs or lie flat on his or her back. If the person is responsive, check the person for injuries that might have happened as a result of the fall, put the person in the recovery position, call 911, have the person follow up with his or her healthcare provider. If the person is not responsive, begin CPR immediately and get the AED as soon as possible. Stroke. Signs and symptoms: trouble with speech and language, including slurring words, being unable to form words, or being unable to understand what others are saying. Drooling or trouble swallowing, drooping features on one side of the face, trouble seeing in one or both eyes, weakness, paralysis or numbness of the face, arms, or legs, especially on one side of the body, a sudden, severe headache, dizziness or loss of balance, confusion, unresponsiveness.
If you think someone might be having a stroke, conduct a FAST check. F stands for face. Ask the person to smile. Does the person's face look uneven, or is there drooping or weakness on one side? A is for arms. Ask the person to raise both arms in front. Does one arm drift downward or appear to be weak? S means speech. Ask the person to repeat a simple sentence, such as, "The sky is blue." Does the person have trouble speaking, or are the words slurred? T equals time. If the person has trouble performing any of these actions, or shows any other signs and symptoms of a stroke, note the time that the signs and symptoms started and call 911 or the designated emergency number immediately. When a person is having a stroke, every minute counts, so act fast.
FAST stands for face. Ask the person to smile. Is there weakness or drooping on one side of the face? Arm. Ask the person to raise both arms. Does one arm drift downward or appear to be weak compared to the other? Speech. Ask the person to repeat a simple sentence. Does the person have trouble speaking, or his or her speech slurred? Time. If the person has difficulty performing any of these actions or shows any signs and symptoms of stroke, call 911. If you think the person is having or has had a stroke, call 911 immediately. Note when the person first started having signs and symptoms of stroke and give this information to the EMS personnel. Reassure the person and monitor his or her condition until EMS personnel arrive. If the person is responsive but not fully awake, or if the person is drooling and having trouble swallowing, put the person in a recovery position and monitor the person's condition until EMS personnel arrive.